Katie Lachey, who is one of the Updox employees. She'll be able to take you through the product features and enhancements. And then also one of our clients, Dr. Marty Holt, will be sharing some of his personal experiences with using Updox in conjunction with Amazing Charts. To give you a brief history on our relationship, Updox has been one of our longest standing partnerships that we have had as a business. For that reason, they have one of the deeper integrations into our system of all of our partners. So the features that they're able to make available to our end users are a little bit beyond what our other partners would be able to with the limited integration. This webinar will be recorded, and we will be sending it to all people that registered, including all attendees. And at the end of the webinar, we will have a session for questions and answers, either by myself, by Katie, or by Dr. Holt. So I'm going to pass it over to Katie and let her show you some of the features of the product.
Thank you so much, Adam. As he said, my name is Katie Lachey, and I'm the Director of Sales Operations here at Updox. I'm just going to take you through a little bit about kind of how we help Amazing Charts practices, both with efficiency on their day-to-day lives and also saving costs in a climate where you're constantly being pushed to do more with less for independent physicians. So I'll go ahead and jump right in. Updox is, one second, get this guy to, here we go. As he mentioned, we've been partnered up with Amazing Charts since 2009, which is actually right about the time that Updox started. So that's been a really great benefit specifically to Amazing Charts customers, because a lot of the solutions that we've built over the years, we started with a basic portal, electronic faxing. We've evolved that portal to add additional functionality, and a lot of those enhancements and new solutions that we're able to roll in were developed with an Amazing Charts practice in mind, since you were such an integral part of our start as a company. Now we are helping as many as 3,500 Amazing Charts providers, the last time I pulled that number, and we're helping them in a couple different ways. We have the free version of Updox, which is the solution for meaningful use stage 2, and that's going to consist of the secure patient portal for messaging between physicians and patients, as well as direct secure email, which will let you securely email patient health information and transitions of care summaries between physicians. We also have a full solution, which if you move forward with that, you'd have those free patient portal features, as well as integrated electronic faxing, document management. We also have a nice patient payment solution, and then an enhanced portal. So in addition to being able to securely message with patients, you can also allow them to request appointments based on your availability. You can let them complete forms online. You can let them update their demographic information online. And we'll go through each of those solutions in a little bit more detail. But again, just additional solutions to kind of help you with efficiency around your practice on a day-to-day basis. And again, when we are developing these solutions, we do understand that today's independent physician and today's Amazing Charts physician is constantly being pushed to do more with less. So what we've kind of done as a company is continue to ramp our solutions in a way to help you achieve that. So how do we help you achieve that? What we try to do is securely connect you both with other physicians and with your patients. So for coordination of care, being able to use our direct secure messaging for meaningful use stage 1, 2, and 3 here soon. And then communicating with patients, so engaging with them online through a patient portal, both for meaningful use purposes and just developing that relationship and rapport with your patient. Providing those solutions has helped us build quite the community. So we're currently assisting more than 35,000 physicians, over 225,000 users, almost 500,000 direct email addresses, and then 37 million patients with 5 million patient portals strewn in there. So definitely our community is growing. So getting a little bit more specific on how, what we try to do is make an effort to remove a lot of the time-wasting things that might distract you from patient care. We're all familiar with meaningful use stages 1, 2, and 3, and the burden that that's placed on practices to manage reporting and compliance. We actually have a 20-year veteran at Updox with a background in compliance, and what she focuses on in its entirety is the CMS, ONC, MU regulations, the presentations and the depth that she's able to go to just offhand, let alone with the assistance of research, has really helped us steer as a company our partners through some of those ever-changing circumstances. We also try to help some of the more tactical things that you use on a daily basis, like the large fax machine in the corner, for instance. A lot of the customers that we speak with from Amazing Charts, when they come to us, are still using a paper fax machine, so they're still limited by waiting for transmission reports. Their lines are still tied up if there's a long fax coming in. Sometimes they wait until the end of the day to send a big fax. So again, a lot of those nasty day-to-day things that might inconvenience the practice staff. Just a little bit more information on kind of the pains that might be experienced by support staff. Another big thing that we're able to do with our portal, so faxing is a pretty clunky process if you're doing it paper-based, but the other really important feature that we're able to help with that practices might not think of it from a time-saving perspective is the patient portal. And the big way that we're able to help with that is that practices will spend hours in a day calling and recalling and playing phone tag with patients that might be at work or not able to get to their phone. So you're leaving them a message, they're leaving you a message, and you're going back and forth to determine whether or not you need to book an appointment. Our portal has really helped practices move patients forward, get them booked, get them into the office, as well as keep that communication open once they leave the office too. Our payment solution, again, kind of in the same vein of chasing patients down, if they have a past due balance, we can actually send them a patient portal message letting them know that, and then through our payment portal they're able to submit payments there as well. Other practices are using our payment portal for a telemedicine type situation, or co-pays for phone consultations, those types of things. Our payment solution's really been helpful for them as well. So there's definitely some tedious things that we could afford to get rid of on a practice basis, but a lot of the time when you have a solution or a pain, the change that would be necessary to get rid of that pain seems bigger than the pain itself, so maybe you stay where you are doing what you're doing. And we're used to that. We know that change is hard for medical practices. We know that you don't have a high comfort level with technology because you've dedicated your life to patient care. So we're absolutely used to hearing that, and that's a common concern that we hear when providers and office managers start to evaluate our technology solutions. The two biggest concerns that we probably hear are time and cost. So from a time perspective, you're always on the hook to stay up with requirements such as the ICD-10, meaningful use, and whatever comes next. A lot of times practices are comprised of workers that aren't necessarily enthusiastic or passionate about technology, so the concept of a clunkier paper-based process seems more comfortable because they're more used to it. Definitely something that we're used to hearing. From a budget perspective, we understand that your budget is tight. You don't have room for unnecessary expenses. I also know that most small practices, if you ask them how much they fax, they will say, I fax a lot. And it's up to us to kind of quantify that and figure out what a lot means for a practice and show that we are cost efficient. So fortunately, we do hear these all the time, so it seems to be pretty universal across the board for small practices. And as a result, we've kind of built our solutions and our pricing models and our functionality in a way to make sure that we're keeping it simple for people who aren't comfortable with technology. We're keeping it cost effective for practices that are worried about the bottom line. And that's actually a big reason why we pulled in our speaker, Marty Holt, that's going to be speaking a little bit later today. He actually had a really unique situation in his practice where he did have some pushback when these new solutions came around. So he's going to speak a little bit to what his practice had thought about when the concept of technology was introduced and what is his practice comprised of, what are some of their backgrounds that I think will really help you understand just how easily we've built this solution. In fact, a lot of the design is mimicked after email. just to make sure that it's as user-friendly as possible. So we'll get to that a little bit later. I just wanted to make sure I give you a good breakdown of solutions and a little bit of the workflow before that. So as I mentioned, we have a free solution and a premium or a full app solution. I have the breakdown here on the pieces that are included with each. Again, everything that's included in the free patient portal is also included if you go with the full service portal. We've already kind of gone through that one. So for the free portal, you have the meaningful use stage 2 requirements for secure messaging, exporting clinical summaries, and then the ability to securely direct email with other physicians. So that's what's included in the free portal. So just kind of a bare bones solution for meaningful use stage 2 specifically. Once you start getting into the fuller solution, you have integrated faxing. So it's a web-based application. You have access to your faxes anywhere with an internet connection. You have a really easy user interface for you to review them, edit them, sign them, send them to the chart, fax them back out. You can send them to the portal really easily. So just a really slick way to manage those documents once they come in. A couple things that we're often asked about that I wanted to make sure I included in my slide presentation in case you're researching after the event were the audit trail and confirmation pages, because I know that those are big deals when it comes to the medical practice. But one of the big things that our faxing is able to offer you is just the time savings and cost savings when we start to think about toner and paper and the time that it actually spent, the time that is actually spent when you're managing a fax-based process. We also have our enhanced patient portal features. So we have, through this upgrade, the ability to let patients request appointments online through our online scheduling. We actually sync up with your Amazing Chart schedule so that they can see openings based on availability in your schedule. There's also a lot of control that's available there. You could limit how many days a week they're able to schedule, what types of appointments, which calendars. So a ton of control that we'll get into here in just a minute. There's also the ability to let patients update their demographic information. You can have them go there to register for a patient portal, so a little bit less data entry for your staff in that regard. Patient payments, patients can keep a credit card on file for co-pays. You can let them open payment plans so that you're not chasing down those past due balances. There's also electronic forms, and again, the secure messaging that comes with the basic version. Here's just a bit more information on our electronic scheduling application. Again, as I mentioned, it's synced with your Amazing Charts calendar, and you have a ton of control in terms of how you offer appointments. So what a lot of practices will do is rather than opening up their schedule for all appointments and all calendars, they'll pick a day or two a week for a couple of hours that they let patients request appointments based on availability. So you're giving off the impression of opening up your schedule without actually opening up your schedule too much. We also have practices who have their schedules completely open because they believe that it's worth the time savings of playing phone tag with someone to get an appointment on the calendar if they're just able to request it themselves online. So again, two totally different approaches that you can use for this tool, but the end result is the same, and that your patients feel more engaged and you seem like a more tech-savvy practice, kind of staying with the times of the online world. Again, we're able to collect demographic and new patient information. The key fields here are going to be contact information and insurance information that your patients would be able to update through the portal so that you're not grabbing that when they come in through the office. And what practices will sometimes do is ask patients to update this information before they come in, number one, because that counts as them using the portal, so they get credit. And number two, it saves them the data entry of having to update it themselves once the patient gets there. The payment solution is both a payment portal through the patient portal, where they could log online and submit payments to you, and it's also an in-office swiper. Both options, you have the ability to turn on payment plans. You could do memberships. You could also use it as a shopping cart. So if you offer products in office, skin creams, that sort of thing, or services in office, you could keep those as an option as well, so that you could take payment for that in the office. We have a really slick reporting interface so that you can do batch processing. So rather than printing off individual receipts and then folding them up and putting them in an envelope and shipping them to your biller, you could have them run batch summary reports, and they'd be able to pull all that themselves. What some people don't think about for payments as well from a cost savings perspective is that it can cost up to $7 for paper statements. Sending them through the portal obviously is free, but when you think about printing them off, putting them in an envelope, putting a stamp, just the time savings there and the cost savings there is really valuable with the payment solution. So that's just a quick list of the different solutions and functionalities and technologies that Updox has put together for Amazing Chart specifically. I wanted to make sure that I showed you how they all kind of come together. A big goal of Updox, whenever we think through a workflow for you, we try to think through letting you accomplish as many things as you can at one time with as few clicks as possible. But again, keeping ease of use in mind, so keeping it simple for you. So you can't get any simpler than this. This is how you would access Updox. You have a secure button right inside of your Amazing Charts, and that's going to launch your Updox inbox. You're also able to get to Updox anywhere with an internet connection just by going to updox.com and logging in. So if you wanted to log online from your smartphone when you're on vacation, or if you work between a couple different offices, you'd have the ability to check in remotely that way too. But this secure button is going to launch that inbox. And the inbox looks intentionally like email. Your newer messages are going to be on top. Your older messages are going to be down below. You could either have a collapsed view like the one I'm showing here where you see each individual message kind of summarized, or you could do an expanded view so that it opens up the line item and you see a little thumbnail preview for each page in the fax or each page in the portal message, for instance. You're able to deal with these items at one at a time, so I could hit send item and it would choose all 4 pages, or we also save them as individual pages. So if you get a 200-page chart that needs to be split up between a few different chart sections, or if you get one fax that has 2 or 3 different patients included, Updox makes it really easy for you to break up documents before you send them as well. We also have a full editor, so at any point you could click on a thumbnail preview, open up the editor, and we kind of tried to think through what you might need to mark up a document. So you have a text function, you have a signature function, you have a drawing tool, a highlighter, a time and date stamp, anything that you might need to annotate on a document or sign a refill or sign off on something before faxing it out or filing it to the patient's chart is available really easily through this editing solution. A key piece of that integration with Amazing Charts is our ability to file documents to the patient's chart. And in doing so, you would give it a title. You can choose from the categories, and these are going to sync up with the categories inside of the imported item section of Amazing Charts as well. If you are a physician, you're able to sign off on documents while filing, or you can be alerted. So if your staff's doing the filing for you, they can create an inbox message from this screen. And then one really nice feature of our sending screen, whether you're faxing, filing, or sending to the portal, is those same thumbnail previews that are available in the inbox are also available in the sending screen. And the reason is when you mouse over one of the thumbnail previews, it zooms in on it. So if you're faxing or filing hundreds of pages per day and you forget the date of birth for the patient that you're sending to or the date that the lab came back, you can kind of mouse over that thumbnail preview to remind yourself. So just a kind of nice feature that's available in all of our sending screens. You're also able to send items to the patient portal. So the portal messages are going to have the same kind of layout as an email where you have a subject line, a message section. You can include attachments if you'd like. You do have an added functionality that if you wanted to alert yourself if a patient doesn't view something in a certain amount of time, let's say it's urgent in nature, you can say if this item's not reviewed in 24 hours, alert me, and you'll get a nice little inbox notification there. The nice thing about the sending screen too, you'll notice here on the right side that I'm sending to the portal and I'm sending to the EHR. So the same information that I'm sending into the chart, I can simultaneously send to the portal, and that's one of those instances of multitasking that Updox helps practices do. You could take a document and send it to the chart, send it to the portal, and fax it out all on the same sending screen. So just trying to save you clicks wherever possible. Kind of in that theme as well, we have a templates feature that can be used for both fax cover sheets and portal messages. If you find that you're typing the same message over and over again, you can create a template for it so that you're just clicking a couple of times instead of typing the same sentences or patient information over and over. templates really help with that. If you did want to go ahead and fax out, this is what our outbound faxing drop-down would look like. So basically, when you get to that sending screen, you choose the patient or contact you want to send to, and then you choose the action you want to complete. So if I were to say that I wanted to fax something out, it would ask me if I wanted to include like a subject line on that fax cover sheet. We do include customizable cover sheets. You could have just the one, or you could have multiple fax cover sheets if you had a few different purposes. And then on a one-off basis, you can customize the subject line and the body of the fax. So again, another place that templates could be used there. So this is just an example of kind of all three of those things. If you look along the right column now, we're going to go ahead and send this document into Charlie Smith's chart. We're going to send it to the patient portal, so Charlie's going to get an alert that the portal message has arrived, and then we're also going to fax it out to this number. And a kind of added benefit of doing more than one thing at a time is that when this document gets to the chart, it's going to say when this document was filed, it was also faxed to this number and sent to this portal. So you not only have the audit trail available inside of Updox, but an audit trail will follow it to the chart as well. I'm sure that fax failure is not an uncommon thing for our attendees today, so I wanted to talk about how Updox addresses a failed fax. So let's say you fax someone and their fax machine is offline, or someone else is faxing them and they still have a rotary fax machine, so the line's tied up for 30 minutes. We actually proactively notify you when a fax fails with a fax fail notification at the top of the inbox. It'll let you know why it failed, it'll give you the original attachments, and it makes it really easy for you to send it again. You also could go to the sent box at any time, and you'll have a running tally there of any faxes that you've sent out, any chart imports you've done, any portal messages you've done. So again, a lot like an email setup where you have an inbox and a sent box. The nice thing about these folders as well is that they're completely searchable. So if you had someone contact you 3 days after you sent something and say that they either misplaced it or never got it, you can hop into your sent box and resend it in a few clicks rather than having to do the work over again like you would with a paper fax. So that's definitely a time saver that we've heard from practices along the way. This is just a look at our patient payment solution. So from that same application, you're able to access your payment solution once you've activated it. You'll receive inbox notifications anytime a payment is submitted through the portal. You'll receive a little receipt inside of Updox anytime a payment is taken in office. And then as you look up the patient, you can look at their full payment history, any upcoming payments if they have a payment plan, whether or not they have a card on file. And again, this is where we'd go to swipe or type in a credit card number if they were giving it to you over the phone too. Some of our power users have actually taken advantage of this as well for phone consultations or charging for no-shows, which I know is a big problem too. So just some ideas for revenue building through this payment solution. Now, if you were thinking about getting started, so let's say you saw some of the solutions here and you wanted to give them a try, we've always offered a 15-day free trial to all of our customers. We would help complete the connection between your Updox and your amazing charts, get you squared away. We do training for you. From a free portal perspective, if you don't have one of those yet, and that's just where you wanted to start was with a free portal, you would actually just hit your secure button inside of Amazing Charts, and that walks you through the setup. And I believe Angel Support would be able to help you get you squared away from that regard too. But the full solution with the faxing, et cetera, Updox Support would definitely be able to help you with that. And I'll have some direction for you as far as a website that you'd be able to sign into for a demonstration or a trial period, and a really special offer that we have for registrants today that we're running, trying to kind of ramp up and get you all to be able to experience the value of Updox for a longer time than just the 15 days. So we'll talk about that just a little bit later. I'm going to go ahead and introduce our speaker today, though. Marty Holt will be taking us through a little bit of background on his practice. He works at the North County Regional Health Foundation, and they have been an Amazing Charts customer and an Updox customer, so he's been kind of using us both together all along since about 2011. So I will go ahead and hand it off to Marty so you can tell us a little bit about his practice.
Thanks, Katie. So yeah, my name is Marty Holt. I'm actually a physician assistant, and as you can see on the screen there, we have about 9,000 patient encounters every year, so you can imagine the number of faxes that we get. Yeah, and absolutely been on Updox and Amazing Charts pretty much at the same time since about 2011. They asked me to speak today. I'm not getting paid for this. This is, you know, I really believe in Amazing Charts and the Updox and the integration. It's really made things a lot easier in our office. It's even though it looks like there's so many features, it's really easy to use. We have a couple elderly workers there. There's a local foundation that helps put elderly people to work, and so we have two in our office. Neither one of them are computer savvy, and we're a little leery about learning how to do this, but only took a little bit of time. Actually, in less than a day we had them up and working, no problem. They were filing and really helping us out a lot. I actually can't even imagine having Amazing Charts and not having Updox. They just go so well together. You know, we've saved a lot of money on toner. So staff, yeah, initially, you know, when we went from paper to electronic health record, a little bit of pushback. You know, people are so used to kind of getting into one mode of always doing something the same. But once I showed the girls in the front office all the things that it can do, and they realized how much time they were going to be saving, it, you know, it really didn't take long for everybody to buy in, honestly. And you know, in a day I had everybody happy. As a matter of fact, our internet went out, not Updox, our internet went out, and only for a short period of time, but there was a little bit of panic there because everyone got so used to doing everything that way. So fortunately it didn't go out again. So but yeah, once we got them bought in, everything works out really well. You know, obviously the faxing, the filing, really easy. I do a lot of faxes, consult notes or requests for to other specialists, so I'm able to type out a note in actually Amazing Charts, print it to Updox. So I'm not actually even printing to a piece of paper, and then I can go ahead and sign it right there on Updox and then send it to the specialist and also file a copy in the chart. And it gives me a nice fax confirmation so that I know that it was received from the other practice. We've had issues, I don't know about you guys, where, you know, you send a fax and they're, oh no, I didn't get it. And a lot of times they're not really looking, but I'm able to right then and there say, hey, you know, according to our log here, you got the fax at 12:08 p.m. yesterday. And then that excuse actually hasn't really worked for anybody in our office anymore, because then they know, so they just keep a better eye on things. Scanning forms, you know, I think having a completely paperless office is maybe eventually will happen, but in our office, you know, we still have to have paper forms for the patients to fill out. So we have them fill those out. We scan those right in, put them right into Updox, and then the girls file those real easy. Outside labs too, so anything that's not coming in electronic as far as lab results, we have the ability to go ahead and, you know, receive those via our fax into Updox and then easily file those. You know, you can keep your same number, so if you're worried, you know, we've had the same fax number over at this office for 25 years. We were able to keep our fax number, so there was no difference for any flow. Katie talked a lot about a lot of features, but one thing she didn't touch on, which a lot of people don't know, is actually the ability to use your smartphone to take pictures and actually import those into the patient chart. That's probably, to me, the most useful thing, and sort of kind of figured it out on my own, but basically almost everybody that I know in professional setting has a smartphone. So if I have a rash or you know, diabetic foot ulcer, whatever the case may be, I have the ability really easy to take a picture with my smartphone, obviously with the patient consent. You don't have to worry about HIPAA these days, but I haven't yet to have one patient object. They seem to like the idea. I take the picture with my smartphone, and then I actually email it to myself into Updox, and then from there I'm actually able to file it into the patient chart. Really makes it easy. We do see quite a few diabetics, so when if I'm not in the office for some reason and the patient comes back for a recheck, the other providers can, you know, easily just look right into Amazing Charts and see the picture and what the foot ulcer look like, so they have a better idea. you know, picture's worth 1,000 words. You can describe something, but definitely a lot easier to take a picture. The other thing would be one of the docs that I work with actually has his own practice about 30 miles away, so he comes and works with us a couple days a week. And on, you know, multiple occasions we've actually had maybe a pre-op form or something that he needs his attention and needs to be seen. So it's really easy to send it to him in Updox, even though he's not in our office. He's 30 miles away. He, you know, I send him a little text message, hey, can you do me a favor, can you sign this form really quick? He just logs in on the computer there, and he was able to sign it and fax it back to us, and then from there we can file it or forward it wherever we need to. So that's, I would say probably for me the photo thing is probably the most creative thing that I've figured out how to use. The portal, we're just starting to use the portal now, so I can't really speak to that, but I do know the couple patients that I have on it have been pretty happy with it. We've given them the ability to send messages to us and request appointments, and I actually set up a form, not to get too complicated, but I set up a form for the patient to be able to request an appointment and an approximate time, and then somebody in our staff actually calls the patient and confirms the appointment. So that so far is going pretty well, so hopefully we're going to be going fully live with that probably by next month. And other than that, I think that pretty much covers what I wanted to say, and I'd be open to any questions if anybody had any.
Thank you. I did want to mention one quick thing. We're going to break for questions, both for myself, for Adam, for Martin. Any questions you might want answered, go ahead and type and submit those using the question section on your GoToWebinar panel. I did want to let you know before we break too about a special promotion. So I kind of alluded to the fact that we do a 15-day free trial for all new customers. We're a month-to-month service after that. We offer free training and technical support, but there's nothing really special about this promotion because it's what we always do. What we're going to go ahead and do for this event specifically is offer an extended trial, 3 months of free trial of our full solution for anyone that upgrades their free patient portal to the full portal by Friday, August 5th using the promo code FREE43. So this is 3 times as long as any promotion we've ever run. So definitely not something that will come around often. Definitely a good way, especially during the summertime with vacation schedules. If you wanted a longer look at Updox before making a decision one way or the other, this is definitely the best time for you to go ahead and try that out. If you did want more information before that as well, you're welcome to request a demonstration through our website. Someone from our sales team would be happy to take you through. You could register for the free trial either on that website, or you could just upgrade your portal right from inside of the app, or give someone in our sales team a call. So whatever is easiest for you, but definitely a good time and a good event for that. And I will give it back to, is Adam? Adam, will you be doing the questions?
Yep, I'm with you guys.
Okay.
I had one come in, Katie, that I think is probably going to be directed for you. They asked if they would be able to keep their fax number that they have now using your services.
Yes. So when you register for an Updox account, we provide a number that, and it could either be local or toll-free, that they're welcome to use outright if they'd like to. But more often than not, practices already have a number that they don't want to lose. So what we can do is either call forward their existing number to the number we provide, or we could even port the number away from their current provider so that they end up not having to pay that phone provider on a monthly basis anymore, and that kind of offsets the cost of Updox. But yes, you can absolutely keep your number one way or the other.
Okay, great. I got another one that came in. They want to know if there is a contract term that they'd be agreeing to if signed up for this product.
We are a month-to-month service, so for Amazing Charts customers, what that means is if you were not using Updox at all and you wanted to sign up and decided it wasn't a fit, you can cancel your account altogether. We also have a lot of people that are using the free patient portal through Amazing Charts right now, so if you wanted to try the upgraded solutions and then you decide that it's not a fit, we can take you back down to the free version too. So you wouldn't lose the progress you've made on the free portal if you did want to try the paid services for some stretch of time.
Okay, great. Those are the only two that I've had pop up on my end. If there's any individual questions or anybody might think of something following, you can either reach out to me at Lombardi@amazingcharts.com, or you can call into our sales department, and all of my account managers and sales execs should be very well versed in the product and be able to facilitate a conversation from Updox with you as well if you want a deeper dive.
Great. Thank you so much, Adam. Thank you, Martin, for joining us today.
All right. Have a great day.
All right, thanks everybody, and again, we'll be sending out the recording of this to all registrants.